Welcome back, everyone. We're now going to talk about how the immune system can be stimulated. So we're going to talk about interferon therapy. We're going to talk about recombinant IL-2. We'll talk about monoclonal antibodies and their advantages and disadvantages. In this recording, we're going to be talking about how the immune system can be stimulated to fight viral infections through the use of interferon therapy. And then also how it can be used to fight cancer through interferon therapy again, recombinant IL-2 and exogenous monoclonal antibodies. Later, I'll be talking about how the immune system can be primed to fight infection. So before exposure through the use of vaccinations, and once already infected through the use of anti-sera, and then how the immune system can be used to inactivate toxins through the use of antivenoms. Some of these slides are quite wordy, so I'm certainly not going to add any further information apart from what's written here. So with interferon therapy, the mechanism of action of interferon is to prevent the translation of viral messenger RNA into viral proteins, and therefore this halts viral replication. There are three classes of interferon, and they are alpha, beta, and gamma. Both alpha and beta have antiviral therapy, and alpha also has some anti-tumor activity. Interferon gamma, though, is the one that's involved in the induction of the T helper 1 response. Interferon alpha is used to treat chronic hepatitis B or C infections, and interferon alpha is sometimes used in combination with other drugs to treat some cancers. Interferons themselves do not cross the blood-brain barrier, and that can be an issue, if you have a viral infection of the central nervous system and you wanted to treat it with an interferon, it wouldn't be able to cross. In terms then of cancer treatment, this can be treated by either stimulating the immune system or inhibiting it, as we just spoke about in the last recording. So in terms of stimulating the immune system, recombinant interferon alpha, recombinant IL-2, obviously because that will activate T helper cells, and the use of monoclonal antibodies. Inhibiting the immune system then is via glucocorticoid therapy to inhibit lymphocyte proliferation. This can be used for treating leukemias and lymphomas. And then cytotoxic drugs as well will block that DNA synthesis and therefore, block So in terms of cancer treatment and stimulating the immune system, this could be done with recombinant interferon alpha. Recombinant interferon alpha will stimulate those natural killer cells of the innate immune system to lyse cancerous cells. Recombinant IL-2 then obviously will be used to activate those T helper cells, but also to activate those cytotoxic T cells to lyse the cancerous cells too. Can also be treated with monoclonal antibodies that I'll talk about in a few minutes. Inhibiting the immune system, we've already spoken about it through glucocorticoid therapy, and that can be useful for leukemias and lymphomas, and also those cytotoxic drugs that block DNA synthesis such as azathioprine and therefore kill proliferating cells. So recombinant interferon alpha in cancer treatment, so it can be used to treat some solid tumors and lymphoma. It's best used in combination with those cytotoxic drugs such as azathioprine, and it's shown that its anti-proliferative effect may enhance the effect of the cytotoxic drugs. However, the exact mechanism of action is still unclear. It does have some anti-proliferative activity, but it also has antiviral activity. And remember that some viruses are known to induce cancer. So due to its antiviral activity, there's sort of work going on to see if these viruses can be sort of targeted to prevent that cancer from developing. In terms of stimulation of the immune system, as I mentioned, interferon alpha activates those natural killer cells, which lyse cancerous cells as well as virally infected cells. And also interferon alpha will activate macrophages. And remember, those macrophages are those large cells that phagocytose particles or viruses or any kind of pathogen, and break it down inside the cell and then present it on the surface of the cell along with MHC class 2 to other immune cells then for destruction. Recombinant IL-2 then can be used to treat some renal tumors. Adding exogenous IL-2, of course, will increase that T helper cell proliferation and therefore the activation of those cytotoxic T cells, and also activate natural killer cells as well. And hopefully the combination of this then would lead to more lysis of cancerous cells. Aldesleukin is an example of recombinant IL-2 that's used in the Bryant and Knight's textbook, but you don't need to remember that. Now, monoclonal antibodies are also used in the treatment of cancer, and the advantages of using a monoclonal antibody is that it will be able to identify a particular antigen on a particular cancerous cell and therefore destroy that cell. And what that does then, it will lead to, less side effects that you might have if you were using a cytotoxic treatment. So what happens here is the exogenous antibody gets added to bind to a specific antigen, and this may inactivate the antigen. Now, there's an example there of an antibody, a monoclonal antibody that binds to vascular endothelial growth factors, so VEGF, and it stops this hormone from stimulating angiogenesis, right? Remember, a cancer or a tumor needs a good blood supply, and the formation of blood vessels is called angiogenesis. May also stimulate an immune response against that antigen. So the antibody binds to a unique molecule on the surface of a tumor cell, and this stimulates natural killer cells then to attack and lyse that tumor cell. And again, that would be a far more targeted approach that would lead to less side effects. And monoclonal antibodies have already been used to treat certain types of lymphoma, chronic lymphocytic leukemia, aggressive breast cancers, and colorectal cancer. As I mentioned, though, they do provide this targeted response with less side effects, but the specific antigen that the monoclonal antibody is designed to recognize must be present for it to work. They're currently often used in combination with other drugs, very expensive, but the advantage are that they are less likely to be causing damage that could further lead to cancer, such as radiation therapy that can further cause cancer. Okay, everyone, I have finished for this little recording, and when I come back we are going to be talking about vaccinations, anti-sera and anti-venoms.